Hi, I'm Jessica. Welcome to Wichita State University's Old Town campus, which houses the Physician's Associate Program, WSU South, and the Department of Physical Therapy. Admission requirements for our program are a 3.0 GPA, 20 clinical observation hours, an undergraduate degree by the start of the program, and fulfilling the required prerequisites. There are 2 applications to be submitted when you apply. One is through PTCAS and the other is through the WSU Grad School. We're very excited to announce that we are expanding. Now we are accepting 60 students per year rather than 40. Applications open June 17th and close on April 1st of the following year. Here are first-year students Jace, Ronald, and Haley to tell you more about your time as a student of physical therapy at Wichita State.
During your first 2 years as a PT student, you have a mixture of lecture and hands-on work, from bringing in standardized patients to your ICE rotations to simulations in the home health and research lab. You will be fully immersed in different experiences to help you know what your future as a PT might look like.
As a PT student in the program, during your first 2 years, you're in the classroom Monday through Thursday, and then you have clinical observations on Friday. You go on your first long-term clinical placement in the summer after you finish your first year. And in your third year, you have 3 10-week long-term rotations.
These clinical rotations are in different setting types, based on the interests you may want to pursue after graduating. Getting experience in inpatient, outpatient, hospital, home health, and other settings prepares us to make an informed decision on what career path we may want to choose.
Our program is not all studying though. Our students have plenty of opportunities to volunteer or get in clinics where they can interact with patients outside of their clinical rotations.
During PT school, you're going to have a lot of opportunities to do extracurricular activities or community activities. Some of them include Go Baby Go, AIDT, and I Can Bike. Another opportunity we have is stretching a man with muscular dystrophy, and us PT students twice a week for about 2.5 hours go over and stretch him. This helps to prevent contractures and keep his range of motion. This is a really great hands-on opportunity to work with someone that has a neuromuscular disease.
Next, let's hear more about electives from second-year student Aruna and Professor 2.
During our second and third year, we have the option to take 3 or more electives. Some of these electives include pediatrics, neuro, acute care, and more coming as we expand. Patient days are another opportunity where we can practice skills learned in class on actual patients. We have our professors readily available as a safety net if we need additional resources.
This is our acute care and clinical skills area, where you learn about all those transfers and clinical skills your first year. You come in here to learn about acute care and working in the hospital and inpatient rehab facilities. And we also have an elective where you get to work on your skills not only in this room, but visiting hospitals and working in the ICU in the local community facilities.
In our program, you will be taking classes where you'll learn about a lot of different settings of physical therapy, such as acute care, which is like a hospital, home health, skilled nursing, outpatient therapy, just to name a few.
We are now in the research room. This is where most of our research studies are conducted. As a student here at Wichita State University in the physical therapy program, that first year that you come in, you will be paired with a faculty and also a group of students that are interested in a field of study that you might be interested in as well.
After taking generalized courses, their choice of electives, and many other opportunities during their program, the students will graduate with a doctorate of physical therapy. With a 100% job placement rate, our students will be ready to hit the ground running in their new physical therapy career.